I run the Family to Family Health Information Center in the state of Rhode Island. I've been affiliated with the National Family Voices organization since their inception in the early 90s, and to be honest with you, since before they actually incorporated, because I was part of the planning process. And we have been very successful over the last many years, actually. We've been very successful over at least the last decade in establishing family-run organizations, and they run the Family to Family Health Information Centers, which focus on supporting families of children and youth who are raising children with disabilities and chronic illnesses. So we've done this for quite a long time. There is a presence in every state across the country. In the healthcare reform law, we were actually written in as an integral component of the healthcare reform law. And then as the president's budget was released, I believe just yesterday, I have to say I've lost track of days since I've been here, but we discovered that in addition to the $5 million cut that's being proposed for maternal and child health programs in general, there's also the entire funding for the Family to Family Health Information Centers, which is another $5 million in the federal budget. The programs are actually being targeted to be eliminated. So we have years of work under our belts. We have staff actually that started this work purely volunteer, off their kitchen tables, just parents who have kids with disabilities who really want to help other parents, and they want others to learn from their personal experiences. And we've gotten to a place that with very limited funding, that $5 million in the budget, all that gives per state per year is $95,700. So we run programs on shoestrings, if you will. We have collected data over the period of time we've been in existence that we report to the federal government and we report to Congress. So there's lots of data to back up the fact that the work that we do in supporting families, it helps those families with systems navigation, it helps with peer support, it certainly helps with advocacy as the need arises, and we train families as well as professionals who work with our kids and families around things like family-centered care and about public policy and a whole variety of things that come into play when you are working with such a vulnerable population. As I fell into this as a mom of a child with significant disabilities, not a career I chose, but it's become my passion, obviously, more than anything, because in my opinion, it's about equity. It's about a population that's vulnerable, and in most cases, through no choice of their own, they just, through the luck of the draw, basically wound up living in this world of disability. And I personally have worked more than 20 years. As a matter of fact, my son with significant disabilities would have turned 26 years old today. He was one of twins, and the second born of those twins, and he suffered a significant brain injury during his birth. They were full term, they should have been healthy. Unfortunately, it didn't turn out that way. And so today we celebrate Jeffrey's 26th birthday, and we try to celebrate all that Jason taught us in the short 19 months that we had him in our lives. So I do the work personally. It's become a personal mission for me, but there are moms like me, and there are dads across the country who do this because it's the right thing to do. And when you look at the numbers within the federal budget, and you look at the significance of those numbers, when you talk about $5 million, not that I wouldn't mind having that in my own personal bank account, but when you talk about $5 million, that's a drop in the bucket. And I can't rationalize how we would put a program like that at risk that is proven with data. I don't know if it's a philosophical statement. I know it was important enough for our administration to put it in the health reform law. What has changed in the last 2 years to make that to make that particular initiative a target of budget cuts? I work extensively in my state and policy work. I am very much entrenched in the healthcare reform implementation process. Rhode Island, which is where I'm from, is one of the states that is probably ahead of the game in a lot of the work that we've done on healthcare reform. And it's disappointing to know that for a very long time we've been so committed to this work, and as we watch healthcare reform roll out and be implemented in some form, as we don't know what the government will do with that law as we go forward, it's just, again, it's somewhat disheartening. In many ways, disheartening or not, I've learned over the years the hard way that you have to get over those bumps in the road really quick, and you have to basically just keep pushing forward because those kids and those families need us. We can't walk away. Again, my surviving children are very healthy. I continue to do this work because my son still drives me to do this work, and it is the right thing to do. Families are better off when they're supported by other families who've been through the process, and our partnerships with the professionals who care for our children make all the difference in the world in the quality of health care that they receive.